Hello, welcome back to part 4 of lecture 2 for Community Health Advocacy Social Movements, module 4. In our last lecture, part 3 of this lecture, we were talking about holistic approaches to mental health. We're moving on to relaxation and stress reduction techniques. Biofeedback is a technique that focuses on learning to control heart rate and body temperature. It may be used in conjunction with medication to treat depression and schizophrenia. It's actually even just being aware of the internal environment in your body. So you can even just use it to relax yourself. So I think this is a really great technique, and there are similar things in the alternative and traditional medicine approaches that we were talking about on the previous slide. So I think biofeedback is really interesting and worth looking up if you have time. Visualization, the patient creates a mental image of wellness and recovery. This is also really powerful. Again, it's there in some of the Eastern traditional medicines and healing paradigms of intention, attention, manifestation, as they say in yoga, which is the last one, which is believing in something, putting attention on it, and seeing that when you put your attention there, it happens. And that's really powerful for healing. If you've ever noticed, or if you ever had a patient who had doubts about getting well, or was apathetic, or just didn't have the will to get well, they may, if you've noticed during your experience with patients, that their outcomes are often not as good as patients who visualize, oh sorry, I'm on the wrong slide, visualize their recovery. Massage therapy is a really powerful healing modality as well. Very often stress, toxic stress that's built up in the body for a long time, it can be released through just relaxing the muscles in our body from massage. And so this really helps. It can help depression, it can help anxiety, other mental health issues just through massage therapy. I know we have one massage therapist in our class, maybe more, and I just want to say that this is a very powerful technique even for people with other disabilities such as Parkinson's and neurological deficits and disorders, to stimulate healing and positivity. So yoga and meditation, we talked about this briefly, that this is just a ancient technique and science from South Asian subcontinent that utilizes that relationship between the state of mind and the breath to generate positivity and relieve stress. And it teaches that every emotion has a corresponding rhythm of the breath, and that it's not a one-way relationship, that it's not our emotions that always have to dictate our breathing patterns, and that we can also take charge of our emotions by taking charge of our own breath. So that's a useful tool for stress reduction and for cultivating calm or peaceful or quiet mind. So in conclusion, for the Nancy Niles portion of our lecture, there have been difficulties in establishing a comprehensive mental health care system in the United States. That being said, I think the healthcare system for mental illness has come a long way here, and there's also still a long way to go. underfunded is usually it's underfunded due to lack of knowledge and prioritization of mental health care in the mainstream medical system. There's been confusion by health insurance companies on how to bill for just therapy and community mental health programs of going out and doing home visits and things like that. So that's been a barrier to reimbursements from Medicare or Medicaid. There's a fear of stigma from patients. People experiencing mental health issues may not seek care because they don't feel safe for people to know about their condition. The Mental Health Parity Act of '96 and its amendment in 2008 were a huge step forward to establish a fair system of treatment between mental health disorders and physical health conditions by mandating annual and lifetime limits to be equal between mental health and physical health establishments and treatments. And so it's now more acceptable to treat mental health conditions with both traditional and alternative modalities that we discussed on the last few slides, as it is with medical appointments with the psychiatrist. So it's getting easier to incorporate different forms of mental health and wellness, which is really great and a huge step forward. So now we'll move on really quickly to psychological first aid. You have the Everly article, and he said it is a supportive and compassionate presence designed to mitigate acute distress and facilitate access to continued care if indicated. So many of you have worked in emergencies and disasters, and with the public health perspective on emergencies and disasters, mental health casualties would far outnumber physical casualties by a projected factor, according to Everly, ranging from 4 to 1 all the way to 50 to 1, depending on the cause of the disaster. And I find this a relevant or true example if you think of just any kind of like the Indonesia earthquake, that how many people actually lost their home or got physically injured compared to how many people maybe lost everything, or their family their grandmother lost her home, their parents were gone missing, or other traumatizing experiences that cause mental distress, and what to do in that situation is a psychological first aid. So psychological distress and trauma are potentially contagious, and this is another principle that I find relevant, because when a loved one or someone we know very well or care about, or our entire community is grieving or worried or distressed or traumatized, we may feel that pain inevitably, and there would be a distinct shortage of mental health clinicians available to provide acute psychological services. And again, that's true if you've ever worked in humanitarian aid or in emergency relief or disaster relief. Many of the people who come are paramedics or doctors or nurses, and how many of them are counselors, psychologists, psychiatrists, or often there aren't enough to deal with the hundreds or thousands of people that get affected by large-scale disasters. Core competencies, according to Everly, for psychological first aid are stabilization, interventions designed to reverse escalating psychological and behavioral reactions, discourage impulsive actions, and instill a sense of calm. Assessment, the determination of current psychological and behavioral status with regard to one's ability to function in a constructive manner. Empathic communications is another big skill, the ability to communicate in a manner that shows respect and concern, and that fosters continued dialogue and compliance if indicated. Additionally, acute interventions are needed, psychological and behavioral interventions designed to mitigate acute stress and instill hope. So this could be education, stress management, cognitive reframing of a situation, triage, the utilization of response-based criteria to determine the need for continued care, access, so facilitation of access to continued care, skills in liaison and advocacy, if indicated, and self-care, the practice of self-care for the interventionists. So that's another big part of psychological first aid. So we'll conclude our lecture there for today. If you haven't read the readings, Everly chapter 13, and checked out the videos in your readings section for week 8, please do. Your assignments for the week are coming up, so stay tuned for that, and have a happy Veterans Day, and I hope that all of you who have served the country or have a loved one who've served the country spend time doing the things that you enjoy and love and with the people you care about. So have a wonderful day and a great rest of your week.